$16 billion has been pumped into the system itself to try to correct the problem of the wait times just since the summer. So there's been a huge effort to try to correct this.
And earlier on Sunrise, if you missed it, we spoke to the local head of the VA to get actually a pretty good progress report on the slowing the quicker wait time so that you can get seen by a doctor faster than was the case earlier. If you missed it, we will have that later on our website, hawaiinewsnow.com. But that was not the end of our discussions with the VA regional chief, because we wanted to know just what was the scale of the project, how many people are being treated, and what are their expectations for the future. So let's find out about that. We're back with Wayne Pfeffer, who's the regional director of the VA and has been working all summer basically on trying to shorten the wait times and whatnot. Let's get into that just a little bit more, because I think some people don't realize just how large an organization we're talking about and just how many people are involved. So first of all, how many patients are treated just in the VA Pacific region?
We have about 50,000 patients that are enrolled for care. We see about 30 to 35,000 each year, and that's on all the Hawaiian Islands, Guam, American Samoa, and Saipan. How
many employees, and that's not counting contractors that work with you?
There's over 800 employees that work on a day-to-day basis with us.
So it's quite a major undertaking, and you've been operating not only under a lot of public pressure, but also under some special funding recently and special legislation. Earlier we just mentioned the Obamacare Act, but actually for veterans it's a different law?
It's the Veterans Choice Act.
Okay. What do you think is going to happen across the next 12 months?
Well, interestingly, our goal is to assure that we have no waiting list and we give timely care and we continue to expand services as the needs arise. There's 3 states in the country, Hawaii, New Hampshire, and Alaska, that don't have a veterans hospital per se. So those veterans will get a choice card, and with that card they can arrange for appointments at private physicians. There'll be a network established and a number for them to call if they choose to go outside of the VA system. Our hope is that people stay with us for continuity of care and for the services we provide. It's very comprehensive health care at the VA, as opposed to going to different doctors' offices for different episodes of care. But veterans will be given more choice. And if for some reason the waiting times increase, which I don't anticipate they will, it gives them the ability to see a doctor faster. So it's actually a great thing to have for them.
Tell me how you make use from time to time when somebody's in a remote location of telemedicine.
We have telemedicine capacity throughout the islands, Guam and American Samoa, where clinicians from here or anywhere else can hook up and see veterans at their clinic if the expertise is not available at the clinic. We also have teams that travel out to patients' homes and to community centers where it's very difficult for veterans to get into the community. So we're trying to bring care to the veteran as close as possible to where they live.
I would imagine that on any day you come to work, and everyone who works for you comes to work thinking that this is important stuff we do, but it's got to feel even more like that on Veterans Day.
Oh, absolutely. I'm very honored and privileged to serve the veterans, and we're very dedicated to provide the best care we can. And if there's any problems, we try to rectify that and continue to improve our system.
Okay, so that's the latest on VA medical care, something we've all been watching a lot lately, and on which a lot is being done right now, guys.
Yeah, and I think that's great, because I think that's why we wanted to do this show. Everybody gets behind the troops when they go out overseas. Right. They make those sacrifices, defend our country. Then they come here and they sort of disappear. They become homeless. They have PTSD, and nobody's around for them. So it's good to see that they're making improvements.
Yeah, big strides.
Taken care of.
Howard, thanks for sharing that.
Yeah.
Absolutely. All right, we have much more coming up on our show today as Sunrise is on the battleship Missouri. We'll be right back.